forgotten. They will always be remembered and cherished for our lifetime. I am here to provide you with the updates with the progress of the National Task Force COVID-19. As for today, we have, as we can see this board, we have 2,600 new cases, confirmed cases, and 107 deaths, and 51 who recovered. If you will see the data, the increase of the new cases has been 322, which is lower than the highest cases that we have last few days ago of 538. This is a good sign that we are gaining the battle despite the many tests now that we had right now. And the death is increased from 11 to 107, and we have one recovered. In these parameters, we need that the rate of death will be diminished to the minimal and to zero. And we want to increase the recovery of our patients. Last 31 March, 15,000 of the PPEs arrived at Villamor Air Base coming from China. It was immediately distributed to the following hospitals. We have the Philippine General Hospital, the Jose Rodriguez Memorial Hospital, the Lung Center of the Philippines, the East Avenue Medical Center, and the Armed Forces of the Philippines Medical Center. These are our frontline government hospitals that dealing with the COVID. These are the part of the first batch of the 1 million PPEs under the government-to-government procurement agreement between the Philippines and China. The remaining 985 PPEs are scheduled to arrive between April 6 to 24. So our donors are we are soliciting the PPEs to our very gracious donors, and we are expecting to have 30,000 of those coming from Soler, from Mr. Razon. And we would like to also thank Mr. Ramon Ang for pledging to support more than 100 ventilators that they will procure from different sources. And also they promise to buy additional PPEs worth 500 million pesos. For the distribution of PPEs, the Department of Health is looking at the bed capacities and number of COVID patients to identify hospitals that critically need PPE. For faster and more efficient communication, we have set a Viber group with the different hospitals so that we can address and respond immediately among the things that they need. I was also able to talk with the Indian Commerce that the group will be procuring 6 million masks to be distributed to the people through Mercury Drug and other drugstores so that public can purchase them at a very lower retail price. With a strong partnership between the government and the private sector, we were able to normalize the medical supplies of the Department of Health. As you can see, the Bayanan spirit is alive during the difficult times. We would like to thank the private sectors and the individual citizens who extended assistance to their countrymen. On the quarantine facilities, within the next 10 days, we hope to convert the Rizal Complex, World Trade Center, the Philippine International Convention Center, Cultural Center of the Philippines as mass quarantine facilities. We will also deploy 3 doctors and 50 nurses at the Rizal Memorial Sports Complex coming from the Armed Forces of the Philippines. The Secretary of DOH will inspect it tomorrow, and it might be open soon. This is for either the PUIs or the mild cases of COVID, so that we can declug the hospitals that are now being overcrowded. In addition above, we are looking also the possibility of converting Quezon City Institute, the Philippine Sports Complex Ultra, Duty Philippines of Parañaque, Amoranto Sports Complex, the Quezon City Memorial Complex, and the Veterans Medical Center Complex into quarantine and isolation facilities. CHED Secretary Popoy De Vera also called me last night also converting their convention centers in Bicol and other areas for mass quarantine facilities. We would like also to announce that we have now 9 accredited hospitals, and we are asking the DOH to expedite other hospitals' requests for accreditation for the testing, so that we will have other capabilities in the testing. On massive testing for PUIs and PUMs, we are also determined to fast-track the accreditation of substantial laboratories so we can start to the massive testing of the PUIs and the PUMs. We expect that by April 14, we shall be able to start massive testing. As you can see in this graph, located in here are the most cases in COVID. As you can see, we have St. Luke's, we have 71, and another St. Luke is Quezon City, we have 68. As you can see, the highest cases within the best hospital that we had. So I am very confident that we will increase our recovery because we have the best hospital in this area. So meaning the top 10 hospitals where we had more than 500 COVID patients are located on our best hospitals. So we have done this mapping so that we can see the conditions of the different COVID situations, whether these hospitals will be needing the assistance of the medical command center. This is a medical command center wherein we have a very tedious monitoring on the different hospitals. We have a GIS representation of the map, and also we have the updated figures on how many COVID patients being attended to by the different hospitals. So this computer generated data will be needed in order to have a good response to our patient. Maybe we can show the curve on the daily paano espasyon natin yung curve yung trending natin. We can see the trending. So dito natin nakikita rin yung trending ng natin, how did the rate of death and the rate of new is being computed in here. Cut muna natin. Dito naman po ilalagay po natin, ito yung tinatawag namin, dito yung tinatawag natin na this is the logistics cell. This is the operation cell, and this is the logistics cell. Dito po natin titingnan yung mga needs. Nakalagay po dito yung mga bed capacities ng ating mga different hospitals, at tinitingnan din po natin kung ano yung mga PPE allocations nila. So makikita natin kung how many PPEs are available, how many requirements they are needing in sustaining the long operations and health treatment care in these areas. So ito po yung tinitingnan natin, and then ito po sa kabila naman ito, tinitingnan po natin dito yung geographical locations ng affectations ng ating mga COVID cases. Nakikita natin dito sa more or less 2,600, ang nakikita natin na concentration pa rin ay nasa Manila area. So in here, nakikita natin more than 1,500 has been affected in NCR. At nakikita natin, Quezon City pa rin po ang napakataas with more than 6%, Manila, Makati, San Juan. At nakikita po natin na pinaka-less affected is itong Navotas at saka Pateros at saka Malabon. Meaning, yung nasa northern side, hindi ganong affected. Ang nakikita natin, ang affected is basically doon sa gitna, nandun sa bandang area ng Quezon City, area ng Manila, Makati, at saka sa San Juan. Yan ang nakikita natin ng mga top areas. Doon naman sa different regions, ang medyo talagang malakas na affectation ay ang Calabar Zone with 178 cases and 10 deaths. At ang Region 3 ang sumusunod, meaning nakikita natin ang infection ay contiguous doon sa mga areas na malapit sa Manila. Nakikita natin na ang Region 3 with 65 cases and 5 deaths. And then next is yung Region 7. Kung maaalala natin, sa Region 7, doon nagsimula yung tracking ng first victim natin ng COVID. And then, nakikita rin natin na tumataas na rin ang mga cases sa Region 11, sa Region 8, Region 2, and also sa Region 6. And then sa BARM, meron na rin pong 7 cases. And then ang pinakanakita natin na pinakamahina ang kanilang affectations ay sa Region 5, sa Region 8, and also in Region 12. So makikita po natin na ang pinakamababang affectation ay nasa area ng Region 9, Region 12, Region 5 sa Bicol area, and also in Region 8. So yun po ang may report po natin ngayon na nakita po natin na ang affectation ay majority sa Metro Manila area. Next sa Southern Luzon, and then yung Region 3, yung area ng Region 3. So yun po ang inaano po natin, report po natin na ang ang watch list pa rin natin po ay talagang yung NCR and also part ng Region 3 at saka yung area ng Calabar Zone. Ito po ang nakita po natin na medyo most affected po ng COVID. Maraming salamat po at magandang hapon po sa inyo lahat.